Preparations for reopening educational institutions. In preparation for reopening of educational institutions, heads of institutions should carry out the following. 1. Build the capacity of institutional staff, learners, boards of management, and parents on the management of COVID-19. 2. Ensure adequate clean running water and sanitation facilities in the institution and procure water tanks where applicable. 3. Develop awareness messages and build the capacity of learners, teachers, non-teaching staff, parents, and entire institution community on key infection prevention and control measures in order to promote good hygiene practices. 4. Develop the protocols on hygiene and social distancing measures to be put in place before reopening. 5. Stock up the institution with key supplies including disinfectants, liquid soaps, non-touch thermometers, face masks, and first aid kits. 6. Collaborate with institution sponsors to ensure provision of psychosocial and spiritual services. 7. Map an emergency health facility that is within 10 kilometers and collaborate with county government to have some health personnel assigned to the institution for regular health monitoring and sensitizations. 8. Carry out risk assessment for suitability focusing on space, water, sanitation, provision of meals, transport of learners using the risk assessment matrix provided by the Ministry of Education, and develop mitigation measures. 9. A multi-sectoral team will conduct assessment on the feasibility and readiness of institutions to ascertain the levels of preparedness using the mapping of readiness checklist provided by the Ministry of Education. 10. Ensure compliance to guidelines for issuance of letter of compliance to the institution. 11. Communicate to parents, teachers, learners, trainees on 1. Health and safety measures put in place to guarantee the health and safety of learners and trainees, teachers, non-teaching staff, parents, and entire community. 2. Reopening of the institution based on the calendar released by the ministry. 12. Sensitize parents and the entire communities on their role in ensuring health and safety of learners, trainees, and staff. 13. Sensitize parents, teachers, non-teaching staff, and community members on the importance of hygiene practices and social distancing both at homes and in institutions. 14. Sensitize all learners using age and gender appropriate information, education, communication materials on COVID-19 prevention and control. 15. Constitute institutional COVID-19 response committee to communicate or coordinate response strategies comprising of 5 members, 1 being a learner or trainee, a non-teaching staff, 1 being a member, and teachers. 16. Ensure there is a designated room within the institution premises for use as sick bay or for temporary isolation in case presumed cases occur in institutions. 17. Collaborate with the Ministry of Health through the Sub-County Education Office to map quarantine centers, at least 1 per sub-county in case of recurrence of the outbreak. And number 18, care must be taken in isolation of minors, especially the girl child. Ensure students' rights are always safeguarded at all costs.